Welcome to the fifth part of this series, where we'll be talking about the United Nations High-Level Meeting and some of the key asks and commitments that the World Heart Federation, in collaboration with global experts on cardiovascular health, are asking the heads of state at the United Nations High-Level Meeting 2025 to adopt. My name is Ogweno Stephen. Let's roll. The fourth priority, the fourth key ask that the World Heart Federation, in collaboration with cardiovascular health experts, are asking of the United Nations High-Level Meeting heads of state is to support evidence-based actions for cardiovascular health. Evidence and research shows that up to 30% of deaths and mortalities and suffering caused by cardiovascular diseases could be avoided by adopting some very simple, cost-effective, and sometimes cost-generating evidence-based interventions, which I'll be talking to you about in this video. The first of those focuses is an increase in cardiovascular health promotion actions. These include the full implementation of the World Health Organization framework on tobacco control, controlling alcohol consumption, supporting cross-sector collaboration, and healthy eating for all. By investing in and implementing these simplified health promotion activities, we are able to see a rise in health and wellness of communities and a reduction of deaths and mortalities in cardiovascular-related deaths. The next part of these actions that could really help in the reduction of deaths, suffering, and in the improvement of health, and as far as cardiovascular health is concerned, is adopting some of the cardiovascular care action priorities. These actions include a focus on ensuring all individuals have access to cardiovascular health diagnostics and access to cardiovascular health services and medication. By investing in these activities, we are able to see a reduction in cardiovascular health diseases and an increase in cardiovascular wellness. Also, as part of this package, we are looking at the complete implementation of several packages, including World Health Organization HEARTS and the focus on rheumatic heart diseases, again, to increase the focus on cardiovascular wellness and reduce the burden from cardiovascular diseases. Lastly is a focus on the expansion of the Universal Health Coverage Plan. We are advocating for the expansion of the Universal Health Coverage Plan as part of the cardiovascular care action to ensure that all individuals are covered and all individuals have access to health services whenever they need them. If you bring all of these components together, you'll be able to see a reduction in the death and suffering as a result of cardiovascular diseases and an improvement in health and wellness in as far as cardiovascular health is concerned, which is why the World Heart Federation is also proposing these packages to the United Nations High-Level Meeting Committee. Lastly, as part of these actions to be adopted is the cardiovascular patient and community actions. These are actions that should be adopted that are evidence-based, that have shown that there's a huge benefit from adopting these interventions. This specific action is one that I'm really passionate about as a patient advocate and as a champion for people living with NCDs. And the first item under this action point is the adoption, implementation, and meaningful involvement of people living with cardiovascular health and other NCDs as experts in this field and whose opinions need to be taken seriously as part of the broader implementation of plans and strategies in cardiovascular health care. More than that, there needs to be a broad engagement of civil society organizations. More often than not, civil society organizations offer the watchdog role. They play the oversight role and they keep governments accountable. And there needs to be more power to civil society organizations to be able to really keep governments accountable and keep them on track on the implementation of these policies that have been suggested and should be implemented as part of the United Nations high-level meeting, suggestions and recommendations moving forward. And then lastly is providing avenues for cross-sector collaboration and for, again, meaningful involvement of different actors in these non-communicable diseases. This, primarily through community participation, is a great way, again, to involve communities in the policies, strategies, and implementation that is being adopted as part of this plan to ensure that there's a reduction in deaths and suffering from cardiovascular diseases and an increase in health and wellness in the various communities. These are the 4 principles in this series that I've talked about that the World Heart Federation, in collaboration with cardiovascular health experts, have put together and are pushing forward to the United Nations High-Level Meeting 2025 as a way to increase priority, as a way to increase attention on cardiovascular diseases and cardiovascular health, but also increase attention to the broader conversation on non-communicable diseases. Thank you for listening, and I hope that you're now better informed on some of the key strategies and key asks that are being pushed forward at the United Nations high-level meeting. Thank you very much, and it was a pleasure taking you through this.